Hi, my name is Ashley Rabaza. I'm a nurse practitioner student at Samford University. Today I'm going to be performing simple interrupted suturing. I have a patient today that has a laceration to their arm that is too big to close on its own, and so I'm going to need to suture it. So to prepare the wound, I'm going to first disinfect the skin around the laceration, and then I'm going to irrigate the laceration copiously with normal saline. And then to numb the wound, I'm going to be using lidocaine with epinephrine to numb it, and also for bleeding control. If it was like a finger or a toe, I would not be using epinephrine. The supplies I'm going to be using are a needle driver, forceps, scissors, and then I also have 3/0 nylon sutures. So to prepare it after it's numb and it's clean, I'm going to wash my hands, don sterile gloves. I'm going to put a sterile drape underneath the arm, and I'm also going to put a sterile fenestrated drape over the top of their arm so that I can see the laceration. And then I'll be ready to suture. Now, I would also want to ask the patient about their tetanus status and give a booster if their status was either unknown or if it had been 10 years since their last tetanus shot. I prescribed antibiotics if it was caused from a human or animal bite, if it was grossly contaminated, associated with a fracture, or involved a major structure. When I'm done, I'd apply antibiotic ointment to the site. I would dress with a non-adherent dressing, and then I'd wrap loosely with gauze. I would leave the dressing in place, or tell the patient to leave the dressing in place for the first 24 hours. After 48 hours, they can shower. They wouldn't want to bathe or soak the area. If there's any crusting, they can take a Q-tip soaked with peroxide or warm soapy water and get the crusting off of it. They would come back in 48 to 72 hours for a wound check, and then for an arm laceration, the sutures would be removed in 8 to 10 days. Some things to know for the patient as far as education. You want to let them know that if they develop redness, heat, purulent drainage, or fever, they need to come back for a wound check as it can be infected. And then the local anesthetic should probably wear off within an hour or two. And then I put that in the sharps. And there is my 5 simple interrupted sutures.